If you're a dedicated American Woman television viewer, then you've seen we've been covering a makeover on breast cancer survivor Linda Larson. Dr. Capon and Karamia Medical Day Spa have been trying to reverse the effects of chemo and radiation on Linda's face, turning back the hands of time. Take a look.
Stage 3B aggressive invasive, possible lymph nodes, possible it's so far along, you probably have about a 20% chance of living. Do you know what pain is? Let me tell you. Radiation and chemo, nothing is as bad as chemo. They take you this close to being dead. That's what they do. They poison you. They take you. They want to kill every bad cell they can find. They took 14 lymph nodes, bilateral mastectomies, and all of a sudden there I am with, you know, scraped to the bone because it was such a big lesion, and they found smaller lesions in the other side. He wouldn't let me alone. Usually he just pulls the blanket off my shoulder and meows at me, get up, feed me. He kept kneading with his head, butting against me, clawing at my chest, and he just wouldn't stop. And I finally pushed him away and rolled over just in the right position. He pushed really hard with his head, and this tumor popped to the surface. And I went, whoa, holy smokes. It was huge, 9 centimeters, it turns out, we find later. But I felt that, and it was tender, and I woke my husband and said, Steve, you've got to feel this. It was huge.
Linda realized to her horror that it had been 3 years since she'd had a mammogram.
How did this happen to me? I know better. This can't possibly happen to me. And it did, because I got busy in my life and taking care of other people, being a caregiver. I didn't take care of myself. They took 14 lymph nodes, bilateral mastectomies. It was like Monday, Tuesday, Wednesday, Thursday, boom, we're just there. And so within a matter of a few days, I had to go through all that trauma, and all of a sudden there I am with, you know, scraped to the bone because it was such a big lesion, and they found smaller lesions in the other side.
Once she was diagnosed, she discovered she had 5 generations of breast cancer in her family, and she didn't know it.
The scars of cancer don't have to be permanent.
Hi, Linda. My name's Lila. I'm a nurse practitioner here at Karamia. I'm going to be part of the team that helps in your makeover.
This is going to be a fun adventure over the next 6 months.
The tiredness and puffiness under my eyes.
Get rid of some of the brown around here. Get rid of some of the red.
This brown kind of thing.
Get rid of some of the fine lines. Tighten your skin. Decrease your pore size. A little bit of Restylane in here.
Just a tremendous gift.
The first thing we did was do a consultation after we chose her as the woman that we wanted to do the makeover on. And after we did the consultation, we set up a plan. And the first part of our plan is to get her on the right products. That's just crucial, because we can correct something like we're trying to do with her, but we need to maintain it long term. So correct and maintain is Karamia's logo that we want to do for all of our patients. The second thing we did was to do Botox. And where we did Botox was in her forehead, around her crow's feet. Those are the main areas. What Botox does is our nerves that contract, those are our dynamic muscles that go back and forth. And we have our 2 nerve ends where the muscles connect, and there's a drug called acetylcholine that goes back and forth. So when we inject the Botox into the muscles, it stops the acetylcholine from going like this, so it freezes the muscle. Thermage is a technique that's radio frequency. What it does is it cooks the collagen. And the collagen and the elastin, which are the building blocks in our skin, as we get older, they start to fall, and our building blocks become a little bit loose. And if we look at my arm and we sort of pull down here, when I was 20 I pulled down and it sprung up, same with here. And then at 30 it stayed down a little bit longer, at 40 a little longer, now at 50 it's not springing so much anymore. So what Thermage does is it goes into the skin, it eats away that collagen, causes immediate contraction of the skin, and then over time we grow new collagen and new elastin, and we get new structure in our skin, and we have more elasticity, and we have more vibrant skin.
We're going to do one eye at a time.
Okay.
I'm going to put a topical numbing anesthetic drop in your eye, so it will just kind of numb your eyeball, okay? Then I'm going to put a shield inside your eye, and then what you will feel is a sensation of heat. In terms of the procedure, no, I've never had any complications with it. The shield will completely protect your eye. You still may feel that heat on the surface of your skin, but not any that's going to be being delivered to your eye itself.
Look, I've been scarred by this disease, but it is repairable, and don't give up hope. Hang in there, keep struggling, keep fighting the battle that, you know, these changes are here and available for you.
I'm going to put the shield in. It's kind of the most uncomfortable thing, but hopefully it'll just pop in for you.
Does it look freaky? I'm glad I can't see it.
The shield's just protecting her eye from the heat. So this is just a paper grid that just kind of outlines where I'm supposed to go. Thermage will lift and tighten. So you're also going to get a tightening effect so that you don't have as much redundant skin of your upper lid, and you get some tightening around your crow's feet and underneath your lid.
Combination of the chemo and the aging, natural aging process anyway, you know, that whole thing is not for sissies.
On a scale of 1 to 4, 1 is you really don't feel anything, 4 is intolerable.
Okay.
You're going to live about 2.5 to 3 on that pain scale. Here's the first one. How was that?
On a scale of 1 to 4, 1. Now that was like a 2 to 3.
Okay. Go ahead and close your eye back. And close. Perfect. Does that feel okay?
Yeah. Oh, very good.
Before we couldn't even see the bottom part of your upper lid, and now we're able to see the bottom part of your upper lid. I think you're still a little puffy right now,
yeah.
So I think in the next few hours that will subside.
Go away. Oh,
your
good.
eyes are a little bit injected right now with the red, and once that calms down, you'll be able to see. But you definitely have a little bit higher peak on your. Look in the mirror and see what you think. It just looks, your brow looks higher there.
Oh, no question. Yeah, I can tell a difference. Right in here is where I see some difference too. How exciting!
Well, what happens, it takes about 6 months to see the results. And usually we don't even see any for 3 months.
To be able to verbalize and see the actual changes that her skin's undergoing, being able to see that her skin feels better, it looks better, she's less tired, and people can notice that about her, it really makes me feel like I'm making a difference for people.
Fraxel's great. Fraxel's the latest thing on the market right now, and what is so wonderful about Fraxel, it is a laser that will help with fine lines, help with deeper wrinkles, help with your texture, help with scarring, help with redness in your skin and with brown in your skin. So it's almost like one-stop shopping, but it has some downtime. So Fraxel's for a patient that's willing to take 7 to 14 days off of work, because we can take 5 to 10 years off with one Fraxel treatment. It's a fractionated laser, it's a CO2 laser that we push the laser beams into the skin, and it makes little holes in the skin, and we remove skin when we do this. And we get immediate contraction and shrinkage, and then new skin grows. But instead of the old-fashioned CO2 lasers that we used to use 10, 15 years ago, where we would remove the top layer of skin and you'd be red and raw for 12 weeks now, within 3 days you can wear makeup, you can go out, you can go back to work. We like about a week off if possible, but this should be her home run.
Stay with us, American Woman. We'll be right back.